you become a doctor without NEET rank? In India, every year 25 lakh plus aspirants compete in. What are the alternatives to NEET? Which country we should go to study MBBS? In this video, we are going to explore all the alternatives and all the pathways through which you can become doctor without NEET. So let's go. Hello everybody, I'm Deepak Sahu, currently a third year MBBS student in Engineering Delhi, and today we are going to talk about on very special topic and very important one, that is, can you become a doctor without NEET rank? Actually, in India, we think that without clarifying NEET we cannot become doctor, but there are alternatives to it, and in this video we are going to explore all the alternatives and all the pathways through which you can become doctor without NEET. So the very first thing that I would like to tell you is the NEET difficulty in India. In India, every year 25 lakh plus aspirants compete in NEET. Yes, 25 lakhs. That's such a big number. And as a result of it, and the exam is so easy, but the aspiring students are so high. As a result of it, there's very high cutoff. But for the government seats, since we all know everybody wants the government medical college, and there's a high government cutoff. Like in NEET 2024, we have all seen that the cutoff is 650 for the general category. 650 is such a high cutoff. Well, it means out of 720, you have to score 650 plus in order to get the minimal college. Yes, the minimal. I'm not talking about the top colleges. For the top colleges, you have to score 700 plus. So this is such a cutthroat competition going on in NEET. As a result of it, maximum students who are really hardworking, really aspiring, who really wanted to become doctor are not getting NEET seats, are not getting into good medical colleges. So there is so much pressure on the medical students, and they are thinking, can we become doctor without NEET? If you cannot go through the cutoff, you have to take the drop. Yes, and what if the next year cutoff rises? What if the next year cutoff rises again? So as a result of it, there's multiple drops. Like students are taking 6-7 drops, even 7-8 drops even to get into a medical college. And as a result of it, so many drop here, there's so much societal pressure, emotional pressure. So now the question arises, what are the alternatives to NEET? In India, if you want to become a doctor, you have to give NEET. There's no alternative, but you can become doctor by studying MBBS abroad. Yes. So what are the benefits of doing MBBS from abroad? And that is the very first benefit is affordable medical education. If you go for the private colleges in India, it is literally crores. But in other countries, it's not that much high. Another benefit of doing MBBS from abroad is there is no NEET dependency. Yes, you don't have to qualify NEET exam. You can directly enroll in university, start your medical journey as soon as possible. So this is one of the very good benefit. Another thing is international accreditation. And what does that mean? There are many universities who give MBBS degrees which are globally recognized. It means you can complete your MBBS in one country and you can practice your medicine anywhere in the world. Efficient career progression, because if you are studying from abroad, you don't have to take drop. You can directly enroll in it. As a result of it, student can complete their medical education within planned timeline and you can start earning sooner. Which country we should go to study MBBS? Now, there are so many things you need to consider before choosing any country. So the most important thing, what are the popular countries Indian students go for their MBBS? Like Russia, Georgia, and Philippines are one of the popular ones because they provide affordable medical education. But they are not the real alternatives, because if you go for Russia, you should know Russian, because if you want to treat Russian people, so you should know the Russian. So there is some kind of language barrier is there. So these are the things you need to consider. First is language barrier. Another, in these countries there is very less hands-on experience in the clinical rotation, because if you really want to become doctor, you should know the clinical skill, not only the theoretical portion. Low FMG pass rates. FMG is the exam that you have to give. Now, also the job uncertainty is also there, and the earning potential is also very less. So now the question rises, are there any good alternatives to all these problems? So yeah, we have. You will have robust clinical rotation. Yes, you can have hands-on experience in the clinical rotation, because you know the US hospitals facilities are so much high on it. So you really will get that exposure of medicine. So it will help you to become a good doctor. And there is a high USMLE success rate. In 2023, USMLE pass rate step 1 में 90%, in step 2 it was 97. Step 3, the pass rate was 97% also. Increase earning potential. Yes, definitely. From your, you can earn up to 60k per year, which is really high as compared, if we compare from the Indian. And the earning potential is so high that you can earn up to 2 crores after you become a licensed practitioner in US, which is such a high amount as compared to India. Global recognition. Yes, there's many US universities which provide you degrees which are globally recognized. You can practice anywhere in the world, so this is really very good. So all these things makes US a perfect real alternative. How the miles US pathway helping you to become doctor in US? So first thing, there's no NEET required, of course, because you don't have to give any pre-medical exam. You can directly enroll in a college, okay? And there's a high earning potential if you go through the miles US pathway. So high earning potential, as I have already told you, that if you become a practiced licensed practitioner, you can earn up to 2 crores per annum, which is really a very good amount. Another thing, robust end-to-end support. So miles US pathway not only give you the consultation but end-to-end support. It means from your initial assistant to your final things, like from your exams and all these things. So they will assist you in every step of your medical career, which is really very good. Another thing, there will be a global recognition of the MBBS you are doing, so it will be globally recognized, and which is really very helpful because you can practice anywhere in the world after that. Now we will understand how miles US pathway helps you to become a doctor. So if you compare the in how to become a doctor in India and the traditional US pathway, so in India and US, traditional US pathway, we have a pre-medical exam. If you go through the miles US pathway, you don't have to give any pre-medical exam, and the 4 year of undergraduate studies will be covered in 1 year of your pre-medical thing, and then after you will be moved to 4 years of MD. Yes, then after 4 years of MD, which will constitute 2 years of theory and 2 years of clinical studies. After 2 years of theory, you have to clear USMLE 1, and after 2 years of clinical studies, you have to clear USMLE 2. And then after clearing USMLE 1 and 2, you will be moved to 4 years of residency, and at the end of your residency, you will give the USMLE 3, and you will become a licensed practitioner in US, and you can earn up to 2 to 4 crores per annum. Now, the important thing you need to notice here is that this step of 1 year of pre-medical and 2 years of theory will be covered outside US. Miles US pathway have some associated universities which will help you to study for 1 year of pre-medical and 2 years of theory, and then after you will move to US for your 2 years of clinic, and then after the pathway is exactly the similar as the traditional US pathway. And the most important thing here is the USMLE 1, 2 and 3. Yes, the interviews occur here. You have to go through a very good interview, so you have to practice well for your interviews, and as a result of it, you will move to your next courses. So this pathway provides you a quick method through which you can, without a pre-medical, you can start your medical journey sooner. You can start earning sooner. You can start earn up to 2 to 4 crores per annum, and as a result of it, this pathway is really a very good alternative for all the aspiring medical students who don't really want to give NEET exam. So yeah, that's it for today's guys. I hope so you will like the video, and please do subscribe the channel for more such good informative videos, and we will see you soon. Yeah, goodbye.